Welcome to the Health Channel, All Health All the Time. I'm Dr. Manuel Torres, family medicine physician with Baptist Health Primary Care. Joining us today is Tina Jacomino, Director of Home Care at Baptist Health South Florida. Welcome, Tina.
Hi, welcome. Thank you for having me.
It's great to have you on the show. In today's show, we're going to talk a lot about home health care. I'm sure you've been a patient in a scenario where you've been hospitalized, you're challenged by your recent diagnosis, you're trying to figure out how you're going to manage at home. And a lot of times that could be very difficult for you as a patient, and we understand that. At Baptist Health, like many other places, we provide home health care. And what does that mean? It's always a very difficult decision, isn't it, Tina? So tell us a little bit about that decision-making process and what home health care is.
Okay, great. So home health care is meant to treat a patient that has a new diagnosis or has just suffered an illness or an injury and needs to get back to their prior level of functioning. It doesn't involve a patient that necessarily was at the hospital, but perhaps maybe is on a new medication, doesn't understand it, maybe needs some help understanding when to take their meds, what they're for. Perhaps they have an antibiotic that they need to administer at home, and our nurses would go out to the home and provide that for you.
So in a way, it's sort of an extension of the services that are provided by the provider, whether, again, like you said, either in the hospital or in your physician's office, that we can extend that care, almost supervise the care in a better way, correct?
Correct. So it's meant not only to enhance the care that you've already received within the hospital facility or from your primary care or any of your physicians that attend to you, but to also transition you from that platform back to your home where you're most comfortable, to make sure that you have the foods that you need to be eating, the care that you need, the nurse to supervise that you're taking things appropriately, and to understand really your disease process.
And one of the most important points that I wanted to make at the top of the show is that the diagnosis drives the need, correct?
Correct.
So not every single patient obviously would qualify for home health care. There needs to be a particular diagnosis, which I find challenging sometimes. As patients come to the office and are asking, oh, can I get home health care, those kinds of things, it leads to misconceptions, doesn't it, as to what home health care can provide. Could you talk a little bit about that?
Yes, absolutely, and that's a great point. Some folks, you know, they have neighbors or other folks that are getting an aid at the house, and they think that that's what home care is. Home care is intended for a skilled need. It's also meant to be intermittent, meaning it's not long-term. It's only used during the actual need of the patient. So as I mentioned to you before, Dr. Torres, if it's a new diagnosis, you've just diagnosed me with CHF, and I don't really have a good understanding of what that disease process means, what things I need to look out for, how to take my meds.
CHF is congestive heart failure.
Congestive heart failure.
That's okay. That's okay.
When to call my doctor when a symptom arises.
What are
so
the
that
signs
would
and
be
symptoms that I need to reach out for help?
Exactly. That would be a good time for us to come out. So what are the things that you need? You need to have a physician's order. So it's either your primary care physician or, like I mentioned before, a cardiologist in the example of a congestive heart failure. You would have to have a skill. So it could be something as benign as education, so teaching you about that disease process and the new medications. And it could be something as maybe more invasive or difficult as an IV administration or an injection that perhaps you're not clear on how to take.
Correct. So these are things that, like you said, the word skill there is very important. It requires particular skill, training of the staff that is going to come where it is probably safer to have somebody who's educated in this. We have a graphic that we wanted to show, which is why home health care and some of the common things. Let's go through this graph together. So one of the things here is, like you said, recovering from an illness. I think that definitely is more from the inpatient standpoint, the difficult diagnosis, right? Undergoing treatment, you alluded to that already. Post-surgical, that's a very common one, correct?
Yes, very common, especially with hip fractures, total knee replacements. The physician is asking the patient to be non-weight bearing for a few weeks. So we don't want those patients going out of their house right away. We want them to get the rest that they need so that they can heal properly. This is a wonderful opportunity for our physical therapist to come out to the home and provide that physical therapy at home.
Correct. And again, the misconception, I think it's important that, especially at the top of the show, we sort of try to help our viewers with those misconceptions. let's go back to that scenario where it's a hip fracture and your functional abilities, like we say, your limitations with your mobility. The purpose and the role of the services you provide are not to go home and do basic stuff like cooking food and getting you to the bathroom. Those kinds. It's really, we're going out there to do physical therapy. There's the skill, if you will,
correct,
where a physical therapist is going to come and help you transition with your physical therapy abilities and your functional ability. Correct?
Correct. And this is all on the oversight of the orthopedic surgeon. So we're not doing this solely on ourselves. It's a collaboration of your physician with our team members. So we have physical therapists, occupational therapists, the nurses. This is a collaborative effort to help you get better and to help you get back to your level of independence where you were prior to that surgery or prior to having the need for that surgery.
Exactly. So there's a lot of things that would specifically maybe qualify for home health care. And we have a graphic that we'd like to show us again, which is the types of services specifically. So let's walk through this graphic together.
Okay.
Skilled nursing, what does that particularly mean? I mean, we talked a little bit about it, but let's just give it a couple more minutes if we can.
Sure. So skilled nursing could be anything from teaching medication.
Mm-hmm.
It could be an injectable. It could be administering an actual IV therapy. It could be going over signs and symptoms, education. Right. We do a full gamut of making sure that you're safe at home, right, that you have the things that you need.
A home survey, I think, is a very useful tool as a primary care physician as well, to have that feedback.
Yes.
Of course, the physician in the office or the physician in the hospital isn't necessarily aware of your home structure. Is it a one-story house? Is it a two-story house? Are there dogs? What is the fall risk? That kind of information is often provided to us, correct?
Yes, that's a great point. That is basically what we do on the first visit. We're assessing the safety of that patient. So we want to make sure when we go out to your home that if there's area rugs that could be a trip hazard, that we're going to educate you and we're going to tell you perhaps that this area rug shouldn't be here so that we don't have the potential risk of you falling. Mm-hmm. We'll look to see if you have fire extinguishers. It doesn't mean necessarily that everybody has to go out and get things, but we want your safety to be number one. Exactly. And we want to make sure that your medications, you have enough of a 30-day supply. We are in hurricane season, and it's important that you have the medication that you need so that if the weatherman tells us, you know, a hurricane is coming our way next week, you're prepared. Correct. And those are things that our nurses take care of.
We did a show, as a matter of fact, about hurricane preparation. And one of the things that I spoke about on that show was exactly that how you have to prepare from a medical standpoint.
Absolutely.
And I actually alluded to home health care. If home health care services may not be provided during that hurricane recovery. So I'm glad you brought that up.
Yes.
Let's bring that graphic back up if we can and continue to go down the list there. Occupational therapy, speech therapy. These are more, again, diagnosis specific, right? So like, for example, a stroke patient may need some speech therapy. A patient who again, has a particular surgery and requires occupational therapy, you know, the type of therapy that is provided in the home is different, correct?
That's correct. And Dr. Torres, just to kind of point out, it might not necessarily be that they had a surgery for occupational therapy, meaning their upper body, because that's the conception or the misconception is that OT is just for upper body. Mm-hmm. Activities of daily living, brushing your teeth, eating, things of that nature. If you've been in a hospital bed for several days, you may have some residual weakness. So we're there to help you out. And it's important that you're going to want to brush your teeth and get back to those days. So occupational therapy helps a lot with that.
Exactly. Then the last two things on that list was home health aid, and we're going to talk about telehome in the next segment, right? Home health aid, I think, is also a big one.
I think that's important to discuss. So a home health aid from a home health agency, a Medicare certified agency like ours, it's important that you understand the home health aid is there during the need of the skill. So while the nurse or the PT is there, you could also get an aid to help you with getting in and out of the shower, helping you bathe, maybe a light meal. But this is not something that you hear probably in the community about an aid being there every day or companionship or, you know, just to play cards with you, that would be a different program. That's usually through a Medicaid waiver program, and that's more companionship. Our aides that go out as part of home care is just for that 1 or 2 weeks to get you back on your feet.
Correct. And the misconception, again, sorry to hit on that
Yes.
again, but what my insurance is going to cover, what are the services that are covered. And if there is a diagnosis, like I said, the diagnosis drives the decision making. If the diagnosis is there, the skill is needed, then typically that's covered by insurance.
That's correct.
When patients, unfortunately, would like things that are not diagnosis driven, that are outside of the scope of what is intended, that often is a challenge. But we can help with those patients too. It just may not necessarily be covered by their insurance, particularly with a home health aide, correct?
That's correct. And I think I'd like to touch on, we're primarily Medicare. So those patients that are Medicare fee for service, those Medicare, what we call straight Medicare, that they're not attached with an HMO. Part of the requirement from Medicare to have home health care to qualify is that you should be homebound. And I think it's important that we touch on what homebound means. Homebound is not a patient that's bedbound, but a patient that has a taxing effort to leave their home. So how does that qualify? If you need a wheelchair or a walker, if you're out of breath, if you need the assistance of a loved one, perhaps your son or daughter or your spouse, that would be considered a person who's homebound. So the only time that you leave your home is to go to a doctor's appointment, or perhaps a religious occasion, a mass or a wedding or funeral, something of that nature. So that's important to know. And you need a physician's order. So you just can't call up and say, I want home health care.
Right.
Your doctor has to be able to prescribe that.
Exactly. So that's a lot of valuable information. And we're going to talk about telemedicine, or I say telemedicine, but telehome care in just a little bit. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Tina or myself, please call in using the toll-free number 1-855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from the past, previous episodes, submit questions for the experts, and we'll be right back.
Hi, this is Terry Bradshaw here to remind you that rheumatic diseases like rheumatoid arthritis and lupus are important to know about. If you're like me, you don't have time for flare-ups to slow you down. That's why I've taken the American College of Rheumatology's pledge to live well with rheumatic disease, and you should too. Things like eating healthy, staying active, not smoking, and managing my stress keep me going. Visit simpletask.org to take the pledge to live well.
We develop quality citizens who keep our core, our country, and our communities side by side on the winning side. Not for glory, but for honor. For a code that isn't written or spoken, but lived. It's what we do. It's who we are. It's the battle cry of our fighting spirit. Battles won. See all the battles Marines fight to win at Marines.com.
Us lives here, where we can be surprised by others and ourselves. For a better us, support your local Y today. us. It's what this country is made of. But right now, our bond is framed. How do we get back to us? The Y fills the gaps and bridges our divides. Support your local Y today. Because where there's a Y, there's an us.
Welcome back to the Health Channel, All Health All the Time. I'm Dr. Manuel Torres, family medicine physician with Baptist Health Primary Care. And with us today is Tina Jacomino, Director of Home Care at Baptist Health South Florida. If you have any questions for us, please feel free to call in at toll-free 1-855-796-4475. So telehome, that's something that we alluded to on the previous segment, and we actually have a video package that we're going to show very shortly. But telehome is the ability to bring technology with home health care, correct?
That is right.
All right, great. So let's go, and we're going to show this video, and then we're going to talk a lot about telehome.
Great.
Doctors can monitor their patients in between office appointments via e-visits, private consultations and virtual rooms that provide doctor-patient interaction without the need to travel to the doctor's office.
Do you think the medication that we prescribed helped you?
The medication is very good and my breathing is a lot better, yes.
Using in-home equipment, Baptist Health Home Care patients can transmit their vital signs to the telehealth center for close monitoring by a telehealth nurse who can evaluate any need for intervention.
Okay, what I want you to go ahead and do is I want you to take about half an hour and I want you to go ahead and retest.
Very good. Sounds like a plan.
Giving patients the support to manage their health in the comfort of their own homes helps them stay healthier, avoids visits to the emergency department, and reduces instances of rehospitalization. The telepharmacists can remotely provide personalized education to patients at home via telepharmacy, explaining dosages and answering questions.
Thank you very much, and we will talk soon.
Bye, Gloria. Thank you.
Have a great day.
So we definitely recognize some people in that video, right?
I've been on camera before.
Yeah. Okay, so let's talk about telehealth and our telehealth center and what that means. What are some of the specifics? Again, the diagnosis drives the decision making, right? So what are some of the specific pathologies, diagnoses that you think that this becomes beneficial?
Okay, well, so this is used mostly for a patient that has congestive heart failure, COPD, any kind of hypertension or even hypotension. So high blood pressure, low blood pressure. The physician typically, when they order home health, they'll write it on the script, but it's not to fear if they didn't, because our nurses are skilled to go out and assess you. And if they feel that you would benefit from this equipment, then they're going to go ahead and put that on the referral. Our office takes care of delivering this to your home. This equipment is temporary. They're going to deliver this to your home, usually within 24 to 72 hours from you being on service. The equipment stays in your home. I'm going to demonstrate to you a little bit of what this is.
Go right ahead. Feel free to do that.
Okay, so this is what the monitor looks like. It's very small, as you can see. It doesn't take up a lot of room. It's color-coded in the back, so it's very easy to install. Green goes with green. The O2 saturation fits right where, you know, everything is color-coded.
And and that can be in any home, right? The home doesn't need to have a landline or...
No special equipment whatsoever, just an outlet, some electricity, and then you need to have a cellular phone, at least, because my nurse is going to contact you. She's going to speak to you almost daily if needed, and we'll go through that. So you don't have to have a landline because this device doesn't get plugged into an actual landline, which most people nowadays don't have. We also have a scale. The scale is, it speaks, so you don't have to bend down to see how much. It'll tell you what your weight is. It'll do it in pounds or kilograms, in Spanish or in English, which is very nice.
And this is equipment that, again, the expectation is that the patient uses this equipment either when they feel sick, right, or if they think they're getting worse, sort of almost as a, I don't want to say emergency, but sort of as a way to say, oh, I don't think I feel right, let me use this equipment, because then the data becomes communicable. It becomes data that can be sent to your nursing staff.
So
that's not just a
absolutely.
random, I don't feel good, let me take my blood pressure, and then that information goes nowhere.
No, not at all. As a matter of fact, we have a designated nurse in the office that handles this. And what she does is she's going to instruct you to take your vital signs, your blood pressure, your oxygen saturation. It also does your pulse. She's going to instruct you to do this on a daily basis, because the reality is that we should be checking these vitals every day, not just when you feel sick. It's important that this information gets sent through, transmitted through a GPRS, which means it just goes through the wavelengths, and it arrives into a computer in my office where a designated nurse is manning that station. She's seeing when your vitals come in, and if anything's outside of a parameter, and we use the American Heart Association parameters for the guidelines, exactly, or whatever the physician has deemed necessary for that individual patient. So if you go outside of those parameters, say your blood pressure is too high, within 15 minutes, the nurse is calling you, and she's going to ask you a series of questions like, did you take your medication this morning? Was there anything that perhaps maybe upset you that caused you to have an elevated blood pressure? We're going to do what we call in healthcare triaging. We're going to ask you questions to make an educated awareness of what is really going on with you. But more importantly, Dr. Torres, when we do get this information, we're not just going to house it in our office. We're going to get this information, and if there's something that we see that there's a spike going on, and it's something that we can't, that we see that it's going to begin to cause some sort of exacerbation, meaning that the disease process is starting to take hold, we're going to contact the physician, whether it be the primary care, the cardiologist, whoever is actually ordering this or monitoring this, and we'll tell them, you know, this patient's blood pressure has been elevated, although they are taking the prescribed medication that you've sent them, and then that physician will give us an order. Maybe they'll tell us, have them up the dose or take an additional pill, or you know what, let's set up an appointment to have them come in right away. And that's very nice, because part of what we do there as well is we facilitate those appointments when they're needed to prevent you from getting to the point where you're so sick you may need to go to the hospital. The goal of this is to prevent a hospitalization. We want you home, safe, and independent.
Correct. So that's exactly right. And we have a graphic that, if we have time, we could show that has information on what are the potential benefits. And it's actually the second to last one: reduces emergency room visits and hospitalizations. It's the ability for us to be able to step into your home, get information, and have that back communicated to us as well. I definitely would agree with the last one on there as well, that it enhances quality of life, and it improves the patient's ability to again interact and be sort of motivated to improve their care.
It manages their disease. Remember, this equipment is going to be delivered to your home, and it's going to be picked up by our office as well for 30 days. Typically is what we put this out. And why 30 days is we want to develop a healthy lifestyle. We want to develop some daily activities that you're doing, that you understand when you feel a certain way, because we've been teaching you to take your blood pressure every day and weigh yourself every day. So when this equipment isn't in your home, you still know that these are the important things that you need to be doing to manage that disease and keep it.
So one of the things that I want to also do in today's show is sort of help our older patients that may be not so technologically savvy, right? And that brings in, and I often say, listen, if you think that grandma doesn't have a cell phone, first of all, you're nuts. You're wrong. But she probably uses it better than we do. But there's always other caregivers as well.
That's right.
There are the people that can make sure that mom or grandma or whoever is doing this kind of stuff, and it begins to sort of ease that challenge with technology. And it involves more people. It involves the caregiver role. Talk a little bit about that, the importance of the family dynamics, the challenges that sometimes you may find and how a family member or a caregiver can begin to help patients with something so advanced as telehealth.
Sure. So a lot of our patients live at home with a family member, a spouse, a daughter, but a lot don't. So to answer both the questions, it's very simple to use. As you can see, it's yes and no. It even has Braille. And there's survey questions that pop up. So it asks you, did you sleep well last night? Did you need to use pillows to elevate, to breathe better? And they're all as simple as just answering yes and no. Again, those simple questions that it reads them to you in again, Spanish and English, those answers get also delivered to our nurse in the office. And if you say no to anything, that nurse is also contacting you to try and help you and see what we can do. As far as a caregiver, it does give the family member peace of mind. So say that mom isn't feeling well and she lives with me. We want to make sure that you know that mom is being taken care of because a nurse is looking at this stuff. And we could even contact you, the daughter or the son, and let you know, your mom's been doing well. These are her trends. This is what her blood pressure's been for the last week. And if anything goes on, a lot of times the caregiver actually tells us, don't call mom, but call me, because we want to be able to intervene when needed. It's very simple, again, to use, but a lot of times when we have advanced age patients that are having difficulty with this, there's always either another family member that can help out with this as well. So it's proven to be very beneficial, and our patients love it. Typically on the 30th day, that's when they get a little sad and they don't want us to remove it because they've grown attached to not only the equipment, but the nurse that's calling them and communicating.
And typically, what if there's a technical issue? What if there's something that, it breaks down, doesn't work?
Sure.
I would imagine that that's pretty easy to...
Oh, absolutely. We troubleshoot immediately. And again, sometimes we also have staff that are coming in, whether it be a nurse or a PT or a home health aide. But let's say that you don't have that anymore because we've already finished that skill and we're just monitoring you for the 30th day. Since the nurse is contacting you frequently, if we notice that your vital signs haven't been transmitted for even 1 day, we're going to call you. And if there's something wrong with the machine, we'll send an aide out with new equipment and we'll swap it out. I'm happy to say that I think that's happened once in the 5 years that we've been doing it, because the equipment is constantly being tested and monitored, and it's in very good condition, and we make sure that all of our equipment is in good working condition.
So excellent. Coming up, we'll talk about how to maintain a healthy lifestyle beyond home health care. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Tina or myself, please call in using the toll-free 1-855-796-4475 number. And please be sure to visit our website at allhealthtv.com, where you can watch videos from the previous episodes or submit questions for the experts. We'll be right back.
It is the most amazing gift that you can give someone. Seeing individuals have an opportunity in their lives that they would never have again.
We all play a role in keeping our community safe.
Every day, we move in and out of each other's busy lives.
It's easy to take for granted all the little moments that make up our everyday.
Some are good, others not so much.
But that's life.
It's when something doesn't seem quite right that it's time to pay attention.
Because only you know what's not supposed to be in your everyday.
So protect your everyday.
If you see something suspicious, say something to local authorities.
Addiction is a dark place, but just as each new day breaks, there is light. A light that illuminates the people by your side. Out of the darkness, you are walking with 22 million others struggling with addiction. The cure to darkness is light. The cure to stigma is love. And the cure to disease is treatment. Join us as we walk into the dawn of a new day. Together, we are stronger than addiction. Learn more at chatterproof.org.
I call you and say, I'm with your son. There's been an accident and he's in jail. He needs bail money, and you actually believe me. So you send cash fast and then bye-bye. Think you're too smart to fall for this? Just last year, 150 million Americans weren't. 1 out of 3 of your neighbors lost $500. Can you believe it? You shouldn't. I made that up too. maybe you will believe everything you're told.
Welcome back to the Health Channel, All Health All the Time. I'm Dr. Manuel Torres, family medicine physician at Baptist Health Primary Care. And with us today is Tina Jacomino, Director of Home Care at Baptist Health South Florida. If you have any questions for us, call us. Please feel free to use the toll-free number at 1-855-796-4475. So we've talked about home health care. Obviously, that's the topic of our show today, and all the wonderful advances and the advancement of technology in telehome. There's another aspect there, which is telepharmacy. If we can talk a little bit about that, a common challenge when patients get discharged from the hospital, all of these new meds, and what about my old meds? And when we see patients after that hospitalization, I always say, bring me all of the meds that are in your medicine cabinet so we can sort through them. How can you help with that too?
Okay, so telepharmacy is huge, and it's such an important and wonderful program that we offer. I want to say, first of all, that telehealth, whether it's the equipment I just showed you or telepharmacy, is free to the patient with Medicare. We provide this as one of our services. In order to qualify for telepharmacy, we just need your verbal consent to say that you'd like it. Basically, our nurse goes out, or our physical therapist, and they write down all the medications that you're taking. Those that were newly prescribed from your hospital visit or when you went to your PCP, and those that you were taking before. That's called a reconciliation. Basically, we want to look at the medication that you're supposed to be taking. There's often confusion with, I was just in the hospital, they sent me all these new ones, I don't know if to take the new, the old, both, or none. And often patients tell us, I'm just going to wait till I have my follow-up appointment next week to decide. And 7 days might be too long. It's also the #1 reason why patients go back into the hospital is because they didn't understand their medication. So that's where home health can really be a benefit to you and your loved ones when they go back home. Just alone, that bridge is important. So telepharmacy, the nurse writes down all your medications. We leave it in the home for you, and we also put it into our computer system. Our pharmacist then, with your consent, looks at all those medications, and we set up a phone call. It could be 7 days a week at the time and date of your choosing. It could be either via the phone or with an iPad so that you can actually see the pharmacist, as you saw in the video before. And that pharmacist is going to take the time to speak with not only you, but any of your family members that are involved in your care. We want to bring you into your care. This is your disease process. This is your livelihood and your quality of life. And it's very important that you take accountability and that you take action within your own health care. And part of that is that the pharmacist is going to review all the meds, and she's going to answer any questions you may have, tell you when it's important for you to take it, not take it. Perhaps you couldn't afford to pick up that medication when you went to the pharmacy. We get scripts all the time, and what we don't know is how much copay or what's covered and what's not covered. So when you get to the pharmacy and you find that it's a $300 copay, perhaps you couldn't afford that. And it doesn't mean that you shouldn't take it. That's where we can help you. Our nurses and our pharmacists.
And most importantly, I'm sorry, I didn't mean to step in, but most importantly, the doctor can also step in and help you out.
Of course, but
and that
that's what we
information
do.
can be communicated exactly.
We facilitate that, right?
Absolutely. And you were talking about medication reconciliation. It is something that I absolutely require every single time, besides of course that it is required, but I make sure that it's done multiple times during the visit, multiple times. Are you sure you're taking these meds? Are you sure? Because a lot of times they're just not. And the decision-making process.
And polypharmacy, right?
Yes,
multiple doctors. So they come to
absolutely.
see you as a primary care, but they also see 3 and 4 doctors.
Correct.
And you have no way of knowing what those other docs are prescribing.
Absolutely.
And that's
and
what's
it's
important.
reconciling across sort of all providers,
Yes.
all levels of care. from the hospital to the cardiologist to me to, all of those different points of care may have different intentions, or maybe sort of like we often say in their silo, and not realize that there's also insulin involved with this patient or whatever. So being able to really reconcile across the board is very important.
And having that full awareness of this medication interacts poorly with this medication, and maybe it's not that your doctor meant to send you that, but your doctor has no idea that another physician has prescribed this to you, because that's not under their scope. So it's important that all physicians be aware, that you're aware, and that's what this program does. It helps us bridge that gap and let everybody know what's in the best interest for you.
So actually, what we want to do is we want to try to move on into chronic conditions a little bit, because we actually have a video that shows self-management. So if we can show that video, that would be great.
The Self-Management Education Program is a program designed to help people who live with chronic diseases learn some coping strategies to help with some of the day-to-day management of living with a chronic disease. A regular doctor's visit really is spent most of the time on talking about medications to treat the chronic disease, really a more medical approach. But what we lose in the time we have allotted is the ability to spend time talking with patients about the day-to-day management of living with a chronic disease. There are some group sessions where patients will go maybe for a couple hours once a week for a few weeks and meet with a group of patients and facilitators. There's some other online resources available, some local groups where patients will meet together. So it varies to meet the needs of the patient, and it can be something that's face-to-face, and it can be something that's online, and there are books available as well. I can't emphasize enough the importance of patients participating in self-management education programs. Living with chronic diseases is so much more than just taking the medicine, and the self-management programs really help patients learn strategies to deal with the day-to-day management of a variety of issues that arise when living with a chronic condition. Patients who live with chronic diseases really need to learn more of the coping strategies that can be taught in a self-management program. I like to tell patients that they are the captain of the ship, I'm the navigator, and really the self-management program will help them know how to be in charge and not let the disease be in charge of them. I have a patient who is having a lot of ongoing pain, and in spite of a whole variety of medication approaches to treat the pain, we were really not making much progress. We were able to get her into a group setting and talk with other patients more about exercise and the importance and how to go about it and what the best types of exercise were. And I think the support of having the other patients with her and hearing that everybody else has these same struggles really motivated her, and she's come back since then. She's exercising, she's feeling better, and really we didn't change anything with her medicines. It was really about her taking charge and finding some ways to change her lifestyle to help herself. My patients lead fuller lives with self-management education programs because they have strategies to help them cope with the day-to-day struggles, and they don't feel so helpless. It really doesn't matter what type of chronic condition you have. There is a program out there for you.
So definitely a word that really resonated in that video was helpless, right? That's what we want to prevent. We want to prevent that helpless feeling. Part of the challenge that I find as a physician is that patients sometimes wants these services to go on forever, and that's just not the case. That's not what the intention is. The intention is, again, as we said before, to get the patient back on their feet, get them steady, and then eventually these services go away, right?
Right, that's right.
I think it's an important point to make.
So it's intended for an acute episode. So it's meant to be an immediate need that the patient has. So we understand that your disease will continue, but this is at the beginning when we want to help you to be independent and then to go on with your quality of life. Something that would be long-term would be a skilled nursing facility or a rehab center, something that's going to continue on for a length of time. This is intended to be that bridge to help you. Typically, when our nurses go out, the first thing that they're going to do with you and your family member is they're going to tell you what the plan of care is. The plan of care is very important because it's going to help you be part of your care, and that's when the nurse or that physical therapist is going to tell you, we're going to come twice a week for 3 weeks or whatever that frequency is going to be, so you have that expectation up front. And then after that, it doesn't mean that another time down the line, you won't need us again. It could be that then perhaps you had a fall, you know, God forbid, but maybe that happens and you need to get surgery, and then you might need our services again. But the point here is that it's not ongoing. The nice part about that too is that, remember, while you qualify for this service, you do need to be homebound. And oftentimes we have many senior citizens in the community that they're not homebound. They still pick up their grandkids, or, you know, they go out and they have a good time, but maybe something happened, like that surgery we discussed. During that week or 2 weeks, they are considered homebound. That's when home care can come in and help you. Then when you're back, you've regained your mobility and you're back to your quality of life, you go on about your business, you go back to those things that you've enjoyed doing. Maybe a year later, something else happens and you're gonna need our services again. But it's not meant to be that continuous long-term care. That would be a different
post-acute
modality. Care, a different modality altogether.
Exactly. So, and then again, just a point that we made earlier was that the diagnosis drives the decision making.
Yes.
As you recovered from, I think a perfect example of this is pneumonia and respiratory issues.
Yes.
You recovered from the respiratory situation, pneumonia, infection, antibiotics were given. You're again now mobile, now able to do the requirements for your activities of daily living, like we say. There's really no need for the home health care.
We would discharge at that point, and then you're on your own. But we ensured that you took that antibiotic through its course. We ensured that you knew things to avoid. We ensured that you knew signs and symptoms of when you were either getting better or getting worse that required a 911
and it's a resource. It's a resource for the patient. It's a resource for the patient.
It's peace of mind too.
Exactly.
It's letting you know that you're not alone, that we're there to help you. Our staff is a compassionate staff of nurses, physical therapists. They all work for us, for Baptist Home Care. They're part of the Baptist Health South Florida network. So these are not folks that are subcontracted or people that we don't know. I know every single one of the nurses and physical therapists, occupational therapists, speech therapists, home health aides. Anyone that we send out to your home works under us. And they're somebody that they're very compassionate, very skilled, very qualified. And I think that you will all find that this is a wonderful service that's underutilized in the community correctly, and I hope that this segment has helped some of you understand what home health does. And if ever there's any questions, you could obviously always call our office, and we'll be happy to help you out with those.
Absolutely.
Or call the show.
Yeah, exactly. Fantastic. Coming up, at what point would you consider long-term care, and how can Baptist Home Care help with that transition for you and your family? We'll find out when we return. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Tina or myself, as you just said, Tina, right? You can call 1-855-796-4475. Please be sure to visit the website at allhealthtv.com, where you can watch videos from previous episodes or submit questions for the experts, and we'll be right back.
Make-A-Wish grants a wish every 17 minutes. I know that sounds pretty magical, but in fact, it takes more than magic. It takes muscle. So, when a kid like Fabian wishes to be a superstar, things happen. Whoa! Or when Kahim transforms into Super Kahim. He feels invincible. It's because wishes have proven physical and emotional benefits that can give children with critical illnesses a higher chance of survival.
Help us make sure every wish comes true. Join us at wish.org.
Don't allow your weight to threaten your health or control your future. Excess weight or obesity can cause emotional and physical health risks. But you can take control. The Your Weight Matters campaign offers free resources and tips to help you measure and understand your weight. Take the Your Weight Matters Challenge. The free toolkit prepares you to speak with a healthcare provider about your weight. Your weight does matter. Take the challenge and take control today.
A smile. It can show how we feel. It can change the course of our lives. But what would life be like if you weren't able to smile? It doesn't have to be this way. Since 1999, Smile Train has been helping children experience the simple joy of a smile. To learn more, call or go online now.
In Saudi Arabia, a genome research program is leading to major advances in precision medicine.
The Saudi Human Genome Program was facilitated by advances in technology, which provided us with the basis to rapidly sequence the genomes of individuals to understand the basis of disease, and this became easily related to the health and welfare of patients.
It's already helping doctors to more precisely diagnose and treat diseases like cancer, Alzheimer's, and diabetes. For more, go to thermofisher.com/precision medicine.
Welcome back to the Health Channel, All Health All the Time. I'm Dr. Manuel Torres, family medicine physician at Baptist Health Primary Care. And with us is Tina Jacomino, Director of Home Care at Baptist Health, South Florida. If you have any questions for us, please call in to the toll-free number 1-855-796-4475. So we want to talk about caregivers. We talked a little bit about that before. Now we're not necessarily talking about the patient, we're talking about family members. And I want to try to close the show with transition to long-term care. So once our services are done, and that patient may need additional things that home care doesn't provide, how do we help transition those patients? So let's go first with caregivers. How important are those caregivers to our patients?
Caregivers are very instrumental in patients' care. Clearly, those are the ones that are in the day-to-day. They're with the patients most of the time. We want to be able to arm them with signs and know what to do when it's time to move on to another progression of care. We primarily hope that most of our patients, when we discharge, and I can say that most of the patients we discharge safely within the community, meaning they stay right where they are. But sometimes patients need to progress to a higher level of care. So they may need, whether it's hospice services because it's end of life, or just for palliative reasons, or if it's long-term care because they require around-the-clock care. So home care isn't around the clock. We don't have a nurse that goes out to the home for multiple hours a day, or she's there for 8 hours a day. She typically goes out, does her skill. I would say you should anticipate an hour visit is typically what happens. Long-term care is intended for more around the clock, if you will. How can we help you is our nurses will provide you with resources in the community. We can provide you with phone numbers, contacts, places that we've worked with that we know are reputable, where you and your loved ones are going to be safe, and that we feel would be a nice combination for them.
And I think an important point is that the caregiver often is a decision maker there. The caregiver often is the one that goes through such a significant educational process, because mom got admitted with a disease that maybe the caregiver wasn't so up to date with.
That's right.
There was maybe even, God forbid, a catastrophic situation. Now that patient has to go through significant recovery. The care for that patient just got very expensive. And not only does the patient need help, but the caregiver needs help too. And a lot of times the questions that are being asked by that caregiver, and that's a resource as well. I often help patients also to understand sort of the different levels of care. When you're in the hospital or in an inpatient rehab, it's very intense, and I'm glad that you alluded to how long they stay. It's continuous. You're in a facility. When there's an ALF, it's assisted living, correct?
Correct.
So assisted living is they move there, they live there, if you will,
right.
correct?
They live in someone else's home. It could be a private home for the more simple ones, and then there's also facilities that you can go visit where you live independently in your room, but you have that watchful eye of that nurse at the station.
Right.
They check in on you. Your meals are prepared for you. There's activities.
Correct.
I know personally in my own family, you know, we've had to deal with that with grandparents, and it's a difficult decision, and it's difficult on everybody, not only the patient, but more so the caregivers, the family.
And I often push the avenue or the thought process of safety.
Yes.
Part of that decision is this is the safer thing to do. The safer thing to do is to have you live at a place where me as the caregiver, I can't be next to your side 24 hours a day. So even the living arrangements often come into discussion and again, transfer into those long-term care facilities. By the way, in an ALF, we can still provide home health care, correct?
Yes, absolutely.
So just because they're in an ALF so-and-so doesn't necessarily mean.
I'm glad you brought that up because
yeah.
yes, we can go to an ALF and provide you with that same skill that we talked about earlier.
All of these skills,
them, physical therapy, a nurse. We can provide that at an ALF. We can also provide that at if you're in a daycare. So perhaps you have mom at a daycare because you work. And it's not safe for mom to be home alone for a full gamut of reasons. You know, you want her safety, you want to ensure that she eats her meals because she might forget them. And then she also needs to get an injection. So the home care nurse would go to your home either prior to going to that daycare or after. But in an ALF, we can also visit there. So that's a good point. You know, it's sometimes the caregiver needs that additional help because, as Dr. Torres alluded to, you know, a lot of us work. So from 9 to 5, we're not home. And
again, we have a few minutes left. The cost part of it. If you bring somebody into your home, again, a private duty aide, like we say, somebody who you would hire to help supervise your family member, that can get very expensive. So sometimes the decision to not sometimes, all the time, it's a financial decision to say, okay, what is easier for us and what is affordable? And when we think about ALFs and all those things, sometimes we perceive that as being extraordinarily expensive or whatever, but it's actually you're sort of putting your money where it's more beneficial for your family member. The cost at the end of the day or at the end of the month may be pretty comparable, correct?
I would agree. I would agree that it is comparable because, as you mentioned, a private aide may cost you between $400, $500, $600, depending how many hours you need her for that week.
Exactly.
But then there's the times that the aide is not there. Then, you know, you have to worry about in the middle of the night. You have to worry about you know, weekends, or if that aide calls out or doesn't show up.
And having them in a quality ALF you can have reassurance. You're sort of buying, again, the safety, the reassurance. You're buying the medical supervision.
The meals, that the nutrition is there, that the medications are being handed.
I've had plenty of patients that have gone into, you know, quality ALFs and have done great, a lot better than what was anticipated. Gained weight and recovered, and here's the most important thing: interacted with peers.
Yes.
That social interaction can even help the psychological aspect of the recovery process as well.
We have to remember that, you know, just because mom or dad get older doesn't mean that they want to be alone. They may say they do, but once you put them in this environment where they can socialize and they can speak to others, it does something to their psyche. You know, it brings up their spirits and gives them purpose.
It also de-stresses the situation, I think, for the caregiver. You feel reassured, well, you know what, at least I know mom is in a safe place. At least I know that she's recovering and doing well, and that all of these services are provided that are diagnosis-driven, medically indicated, properly documented, and there's always good feedback to the providers.
Absolutely.
So a lot of information. I hope that we help some people today. You think we help some people?
I surely hope so.
Okay,
I surely hope so.
Very good. So one more thing that I wanted to say, again, the importance, if we can just give another minute about the pharmacy stuff. I'm sorry, I know I keep hammering it.
No, that's a huge one.
But that inconsistency with medications, please, to our viewers, it's so important that you make sure that your medications are, like we say, reconciled across all caregivers. If your cardiologist prescribed it, your primary care physician needs to know about it. If you were prescribed a new medication in the hospital, that needs to and should continue. Part of the discharge process always is reconciliation of medication. And I hope that we were able to provide some additional information for you today and other resources that can help make sure that polypharmacy is there. And with your technology, you're able to help the patients as well.
Absolutely. And telepharmacy, again, I'll put that plug in there. We offer that for free. We're the only home care agency that I'm aware of in the nation that offers this to our patients. So we believe strongly that medication is the #1 indicator that sends people back to the hospital.
Exactly.
And we really want to prevent that. We want to keep you where you want to be, safe and at home.
Exactly. Very quick, another quick point is the types of medications. Anticoagulants is one.
High-risk medications.
Blood pressure medications. Those. So if you are on those medications, those are very important to make sure that they are continued, that they're continued properly. They require education.
Yes. Psychotropic medications is another one. A lot of times patients will take it because they didn't feel well, and then they decide to not take it, and that could give more adverse effects than not. So it's important that you don't stop a medication abruptly or take double up on pills. Some people miss a dose and then they think, oh, let me just take 2 or 3 the next day to make up for it, and that should not be done. So
exactly. All right. Well, thank you so much, Tina. It's been great. I think that's all the time we have. So be sure to join us next time on the Health Channel, All Health All the Time on South Florida PBS. Follow us on Facebook and Twitter at All Health TV, where you can get health tips from our experts and see what's coming up on the Health Channel. You can also visit our website, allhealthtv.com, to submit questions for the experts or watch videos from previous episodes. I'm Dr. Manuel Torres. See you next time.